So a health check is an NHS initiative where we're trying to sort of catch things a bit sooner so we can probably focus more on prevention rather than treatment.
It is a fantastic exercise, and I can speak of first-hand evidence of patients who have had a health check, and the commonest things we notice are the patient's blood pressure is slightly raised, or patient might have a slightly high cholesterol, or sometimes we pick up diabetes and sometimes pre-diabetes. Health checks are for patients aged 40 to 74, and what GP practices will do is they will look at their patients who meet the criteria, who are on that list, and then they will contact them. Some GP surgeries will send out a letter which patients can then respond to. They may need to phone in, there may be a website that they can go to and book an appointment. Other GP surgeries might just send an email or an SMS message. There'll be a link that the patient can click on to directly book a patient.
So this isn't a 30-minute appointment with the GP, but it pretty much works the same way as any sort of consultation.
When a patient is invited for a health check, they will usually see a trained nurse who will conduct the health check. You will have your weight looked at, you will have your blood pressure checked, you will have a cholesterol check, you will have a check for diabetes. In essence, if you come for a health check and you're between 40 and 74 and you're well, we can tell you if you think you are as well as you are, and we can pick up any problems early on. If we can promote a healthy lifestyle, healthy living to patients, and we can work with patients to achieve that, then we're going to be having a healthier society going forward. We know the patient and we have a copy of their notes in front of us. We know what's gone before, we can look at their clinical record, we can ask about potentially any other minor issues that they've had in the past. A huge advantage is that if we identify a problem, they will sometimes come and speak to the doctor straight away. They'll walk down the corridor and they'll knock on their door and they'll say, "Oh, Dr. Oxley, I've seen this patient, I'm quite worried about their heart rate, their ECG, their heart tracing is not quite right. What do you think we should do?" And on occasion, we will end up seeing those patients there and then if it is a significant problem that needs sorting out. But most of the time, problems that are identified, we will deal with within 1 to 2 weeks afterwards.
I think the patients that do come in for these health checks, they're quite active in making these changes to their lifestyles, and that they do seem to see some real benefits from the health checks. So personally, I think it's a really good thing.
This is exactly the sort of thing that GPs and primary care should be involved with. We all know the famous saying, prevention is better than cure.
If you're aged between 40 and 74 years old and don't have a pre-existing cardiovascular illness, you're entitled to a free NHS Health Check. You should be invited for one every 5 years by your GP. For more information, visit the Public Health Dorset website